Have you ever felt like something wasn't quite right with your body, but you couldn't put your finger on it? A quiet sense that something deeper might be going on beneath the surface? Today, we're tackling a topic that many people overlook until it's too late: blood cancer. Unlike more obvious illnesses, this condition rarely announces itself with dramatic symptoms. It creeps in silently, often hidden behind signs that seem ordinary, even harmless. But make no mistake, this is one of the most dangerous forms of cancer precisely because it can be so hard to detect in its early stages. That's why awareness isn't just important, it's critical. As global cases continue to rise, knowing what to watch for could mean the difference between early intervention and a diagnosis that comes too late. In this video, we'll guide you through what modern science is uncovering about the early warning signs of blood cancer, how the body often whispers before it screams. And while these signs may not seem alarming at first glance, understanding them could quite literally save a life. This isn't about fear. It's about being informed. It's about listening to your body. Whether you're here to protect your own health or to care for someone you love, this is a conversation you can't afford to miss. So make sure to subscribe and stay with us until the end. Because when it comes to your health, every bit of knowledge counts. And remember, this video is for educational purposes only and should never replace professional medical advice. Now, let's begin this journey of awareness, empowerment, and potentially life-saving insight. 10. Swollen, painless lymph nodes in the neck, armpits, or groin. Swollen lymph nodes, particularly when they're painless and located in areas like the neck, armpits, or groin, can raise concerns about blood cancer. This symptom is often linked to lymphomas and leukemias, types of cancers that affect the immune system. The lymph nodes swell because cancerous cells can accumulate in these nodes, disrupting normal function. A study published in the Journal of Clinical and Experimental Hematopathology, 2018, highlighted that swollen lymph nodes, especially when they persist for weeks without signs of infection, should be evaluated. Lymph nodes are a critical part of your immune system, acting as filters that trap harmful substances. When they swell painlessly, it's often a sign that something unusual is happening in your body. In blood cancers like Hodgkin and non-Hodgkin lymphoma, abnormal lymphocytes, a type of white blood cell, can accumulate in lymph nodes, causing swelling. Similarly, in leukemia, abnormal blood cells can cause enlargement of the lymph nodes, spleen, and liver, leading to swelling in various parts of the body. It's crucial to remember that swollen lymph nodes are not exclusively indicative of cancer. They can also swell due to infections or other benign conditions. However, if you notice persistent, painless swelling, it's advisable to consult a healthcare professional for a thorough evaluation. Early detection is key in managing blood cancers effectively. 9. Shortness of breath. Shortness of breath is often associated with conditions like asthma or heart problems, but it can also be an early sign of blood cancer. Blood cancers affect the body's ability to produce and function with healthy blood cells. This disruption can lead to anemia, where there aren't enough red blood cells to carry oxygen throughout the body. As a result, individuals may experience shortness of breath. A study published in BMC Cancer, 2023, highlighted that about 44% of blood cancer patients reported respiratory symptoms, including shortness of breath, at the time of diagnosis. This shows that respiratory symptoms are more common in blood cancer patients than previously thought. The reason behind this is not just anemia. Blood cancers can cause the spleen to enlarge, which may press against the lungs, limiting their expansion and leading to shortness of breath. Additionally, some blood cancers can infiltrate the lungs directly, further impacting breathing. It's crucial to remember that shortness of breath can have many causes, and not all are linked to blood cancer. However, if you notice persistent or unexplained respiratory issues, it's essential to consult a healthcare provider. 8. Persistent weakness and fatigue. Persistent weakness and fatigue might not always ring alarm bells, but in the context of blood cancer, they're significant early signs that shouldn't be ignored. Blood cancer directly affects the body's ability to produce and regulate blood cells. This disruption can lead to anemia, a condition where your body doesn't have enough healthy red blood cells to transport oxygen efficiently. It's this lack of sufficient oxygen circulation that often causes fatigue and weakness. It's not just regular tiredness. Patients describe it as profound exhaustion that doesn't improve with rest. This kind of fatigue can impact daily life, making even simple tasks seem challenging. According to a 2023 study published in Scientific Reports, up to 40% of blood cancer patients reported experiencing severe fatigue at diagnosis. Remember, these symptoms are nonspecific and can be associated with many other conditions. However, when persistent and unexplained, they warrant a closer look by a healthcare professional. 7. Night sweats. Night sweats, those uncomfortable episodes where you wake up drenched in sweat, can be more than just an annoyance. In some cases, they are a warning signal from your body, hinting at deeper health issues like blood cancer. You might be wondering, how does this happen? Blood cancers such as leukemia and lymphoma can disrupt the body's ability to regulate temperature. This disruption is often due to the cancer cells interfering with the immune system and normal bodily functions. A study published in the European Journal of Hematology, 2023, revealed that patients with lymphoma frequently reported night sweats as one of their initial symptoms. But how do you distinguish these sweats from the ones caused by a warm room or spicy food? It's the persistence and severity that matter. Blood cancer-related night sweats are usually more intense and occur regularly. They're not just about feeling a bit warm, they can involve completely soaking your nightwear and sheets, which is unusual. It's crucial to remember, though, that night sweats alone don't confirm blood cancer. They are a piece of a puzzle that might include other symptoms. If you're experiencing these signs, it's important to consult a healthcare professional. They can perform tests and give you a clearer picture of what's going on. 6. Loss of appetite or nausea. When discussing blood cancer, it's important to recognize how subtle symptoms like loss of appetite or nausea can be early warning signs. These symptoms are often overlooked because they're common to many less serious conditions. However, in the context of blood cancer, they play a crucial role. Blood cancers such as leukemia, lymphoma, and myeloma can disrupt the normal functioning of the body in several ways. One key impact is on the body's ability to use and absorb nutrients, which can lead to a decreased appetite. A 2019 study in intestinal research highlighted this, noting that metabolic changes in blood cancer patients often result in reduced food intake. Nausea, another common symptom, can be caused by an accumulation of waste products in the body due to impaired blood cell function. As these waste products build up, they can trigger the body's nausea response. Research published in BMC Cancer, 2023, corroborated this, showing a significant correlation between waste accumulation and nausea in blood cancer patients. These symptoms, while seemingly minor, can be indicative of a larger problem. It's crucial to pay attention to these signs and consult a healthcare professional for a proper evaluation. 5. Itchy skin. Itchy skin, or pruritus, is a symptom we often dismiss as a minor annoyance. However, in some cases, it can be an early warning sign of blood cancer. When it comes to blood cancers like lymphoma or leukemia, the connection with itchy skin is not widely known, but it's an important one to understand. The reason behind this itching is quite intriguing. In certain blood cancers, abnormal cells can accumulate and release substances that irritate the skin. A study published in Dermatologic Therapy, 2019, revealed that nearly 30% of patients with Hodgkin lymphoma experienced persistent itching. This kind of itch is different, it's more intense and doesn't get better with regular lotions or antihistamines. What's more, this itching often occurs alongside other symptoms like unexplained weight loss, fatigue, or night sweats. It's the combination of these symptoms that should raise a red flag. While itchy skin alone is often not a sign of something serious, if it's persistent and accompanied by other symptoms, a visit to a healthcare professional is advisable. For unexplained rash, bruising, or bleeding. Blood cancers like leukemia, lymphoma, and multiple myeloma can manifest through various symptoms, often subtle and easily overlooked. Unexplained rash, bruising, or bleeding are among these early signs, indicating something more serious than just skin-deep issues. These symptoms arise due to the cancer's impact on the bone marrow, where blood cells are produced. When blood cancer develops, the bone marrow is unable to produce enough healthy blood cells, including platelets, which are crucial for blood clotting. A reduction in platelets can lead to easy bruising or bleeding, often without any apparent cause. Additionally, certain types of blood cancer can cause an immune response, leading to rashes. This is because the cancerous cells interfere with normal immune function. A 2023 study published in BMC Cancer noted a significant correlation between unexplained hematological abnormalities like bruising and rashes and the early stages of blood cancers. This emphasizes the importance of paying attention to these seemingly minor symptoms. While not every case of bruising or rash signifies cancer, persistent or unexplained symptoms should prompt a medical evaluation. Remember, early detection is key in managing blood cancers effectively. If you notice such symptoms, it's not a cause for immediate alarm, but it's wise to consult a healthcare professional for a thorough checkup. 3. Fever or chills. Fever or chills are often overlooked symptoms, yet they can be key indicators of blood cancer. This link is highlighted in a 2020 study published in Curious. Blood cancers like leukemia or lymphoma disrupt the normal function of blood cells, leading to a compromised immune system. When your body's defenses weaken, even minor infections can cause fever or chills. These signs shouldn't be dismissed, especially if they're persistent. Research from Infections in Hematology, 2014, reveals that about 90% of patients with leukemia experience fever as an initial symptom. This isn't just a random occurrence. Blood cancers directly affect the bone marrow, where blood cells are made. As cancerous cells multiply, they crowd out healthy cells, weakening the immune response. This makes patients more susceptible to infections, which often present as fever or chills. It's crucial to understand that these symptoms alone don't confirm blood cancer. However, if they're accompanied by other signs, it's advisable to consult a healthcare professional. Early detection plays a significant role in the successful management of blood cancers. 2. Frequent infections. In exploring the connection between frequent infections and the potential early signs of blood cancers like leukemia or lymphoma, it's important to understand how our immune system is impacted. Blood cancers can disrupt the normal function of immune cells, making the body more susceptible to infections. A study published in Hematologica, 2021, showed that individuals with chronic lymphocytic leukemia often experience more infections due to weakened immunity. This happens because the cancerous cells crowd out the healthy white blood cells that are crucial for fighting infections. Similarly, research in Annals of Medicine and Surgery, 2023, highlights that in acute myeloid leukemia, frequent infections are a common early symptom. The rapid increase of abnormal cells in the bone marrow hampers the production of healthy immune cells, leading to this vulnerability. It's not just about the frequency of these infections but also their severity and persistence. If you're noticing that you're getting sick more often than usual or your infections are unusually severe or lingering, it's worth discussing with a healthcare professional. While frequent infections alone don't confirm blood cancer, they can be a significant warning sign, especially when accompanied by other symptoms like fatigue, unexplained weight loss, or night sweats. 1. Coughing or chest pain. Understanding the early signs of blood cancer is crucial, and it's interesting to note how symptoms like coughing or chest pain can be linked to this serious condition. When we think of blood cancers such as leukemia, lymphoma, or myeloma, we often expect symptoms directly related to blood, like anemia or bleeding. However, the reality is more complex. Coughing and chest pain in the context of blood cancer usually stem from indirect effects. For instance, in a study published in Pediatric Surgery, 2012, researchers found that certain types of blood cancer can lead to enlarged lymph nodes. When these enlarged nodes press against the lungs or airways, they can trigger coughing or even chest pain. This isn't your typical cough or occasional ache, it's persistent and doesn't seem to have a clear cause like a cold or physical strain. Another aspect to consider, highlighted in the International Journal of Molecular Sciences, 2022, is that blood cancers can weaken the immune system. This weakening makes infections more likely, which can lead to symptoms like a persistent cough. What's important for you to know is that these symptoms alone don't confirm blood cancer. Many conditions can cause coughing and chest pain. However, if these symptoms are persistent, unusual, and accompanied by other signs like fatigue, unexplained weight loss, or night sweats, it's wise to consult a healthcare professional. Early detection is key in managing blood cancers effectively. As we wrap up today's video, we hope you've gained valuable insights into recognizing the early warning signs of blood cancer. Awareness is the first step toward early detection, and early detection can make all the difference. If you found this information helpful, don't forget to subscribe to Healthy Care and share this video with your loved ones. Your support allows us to continue spreading awareness and empowering more people with life-saving knowledge. Stay with us for more upcoming content on health, wellness, and the latest advancements in medical research. Together, we can take charge of our health and build a future of informed, proactive well-being. Thank you for watching. Keep learning, stay vigilant, and take care of yourself and those around you. Until next time, stay healthy, stay strong.